Welcome to the Center for Health Organization Transformation's Deep Dive webinar series. Today's webinar will be an overview of the Lean Six Sigma as methodology for quality. The presenter for this webinar will be Dr. Deirdre McCaughey. Deirdre?
Thank you very much for that gracious welcome, Leslie. I appreciate it. Welcome, everyone. Today I'm going to talk about Lean and Six Sigma tools and the relationship they have to quality improvement inside our healthcare industry. As everyone likely knows, we have across our industry an increasing number of issues arising with respect to patient safety and patient outcomes. These headlines that you see on this slide are very common with a number of popular press headlines that we all see on a daily basis that identify as healthcare providers and deliverers of care, we are failing consistently in preventing hospital errors and patient safety adverse events from occurring. We know that since the Institute of Medicine launched its groundbreaking reports to Err is Human and Crossing the Quality Chasm, that quality improvement methodology and quality improvement as an attention area for healthcare industry leaders has become increasingly important. Today, one of the focus areas that has arisen as a financial imperative is the Hospital-Acquired Conditions program that has recently been launched by CMS, or the Centers for Medicaid Medicare. If you're not familiar with the HAC, or Hospital-Acquired Condition Reduction Program, essentially what occurs is for the hospitals in the lowest quartile of performance in the country for a number of HACs occurring in the hospital, those hospitals are penalized up to 1% of their CMS reimbursement. And as many of you may know, the average hospital in the United States is currently earning approximately 3.5% margin. So the idea of losing 1% of revenue as a result of hospital-acquired conditions is a very, very financially critical imperative for many hospitals to pay close attention to. So we have, in addition to the moral and ethical imperative of looking after patients and preventing adverse events from occurring, we also, as industry leaders and organizations, have an imperative financially to address healthcare quality. This particular example on this slide is a really good example. It is focused on surgical procedures, but it really is a good example of exactly what's happening in our industry, which is following the CSM institution of a number of payment models that attach financial penalties for poor clinical outcomes to patients. This model really captures the concept of quality-based care or quality-based payments in healthcare. And as our industry continues to progress, we see our private insurers are also looking at the various outcome metrics and measures that they can attach to hospital performance in order to incentivize or de-incentivize performance. And this simply very much highlights very key areas in which there are financial incentives attached to that establish the idea of quality-based payment. The actual processes of care that are being utilized in institutions, penalties for errors or adverse events, penalties for readmissions to hospitals within 30 days, the actual evaluation of patients and their families with respect to satisfaction with their hospital experience, shared saving programs to help hospitals and physicians that are doing exceedingly well share in the savings that CMS and insurers are also capturing with better performance, and then the linkages to clinical outcomes and examining how financial incentives are attached to the actual patient outcome. So really this is, as I said, a really good example of just very much understanding that the new look in our industry simply is finances are attached to quality and quality is important. So for many institutions, that is a growing concern in the sense that we have had, since the Institute of Medicine launched Err is Human and Crossing the Quality Chasm, over a decade of experience in attempting to drive quality outcomes. Unfortunately, the performance in the quality arena has not been as robust as many organizations would like. And so as we talk a little bit about solutions to managing quality outcomes and quality performance, I want to start by just recognizing that when people speak to quality, there are fundamentally two different ways to look at quality inside an organization. One of them is what's commonly referred to as quality assurance or quality control, and that really is retrospective examinations of quality and events and trying to understand why things occurred in an organization. So an example of that would be a root cause analysis that occurs after a patient adverse event has happened. There's also the focus of quality improvement. And quality improvement is a forward focus, so it's more proactive, and it's looking at processes that are in place in an organization and examining the processes and trying to identify ways to improve that process. So it's really important for institutions and healthcare leaders to think very strategically about when you are identifying quality concerns in your institution, are you identifying something that requires a retrospective examination of an incident, or are you thinking forward proactively to look at various processes in which performance might not be at an expected benchmark and then trying to examine ways to improve the process? So very much, as I said, it's a very, very important part of determining what the next steps in the quality improvement process is. Many institutions will typically hear language that is referred to as we need to be engaged in Lean or Lean Six Sigma or become involved in Six Sigma. And this particular diagram is a really nice way to think a little bit about the, if you will, the pyramid of robustness of quality improvement. And really, if you look at the bottom three layers, the quality assurance, the quality control, inspection, again, that's all very retrospective approach to quality, and it's looking at what have we done and where did something go wrong. And really, at approximately the total quality management level, a quality program is starting to look prospectively and looking at the processes we have and going into that from the perspective of how do we improve things. And you'll see, as identified on the pyramid, that Lean and Six Sigma are actually two different sides of a coin when it comes to quality improvement processes. And I want to focus on that a little bit because I think people use that somewhat interchangeably to refer to one collection of tools, when in reality, Lean and Six Sigma are actually different kinds of methodologies. When an institution is pursuing a Lean methodology, they're trying to reduce waste. So what they're trying to do is look at what we're doing, how do we identify the value in a particular process, and what do we do to eliminate the waste that occurs. Again, an example of that might be, often you see organizations will examine processes for supplies in units and wards, and trying to look at how much of the supplies are thrown out or not used, and examine the processes of how supplies are taken and used and utilized and ordered to identify ways to reduce waste. Six Sigma, on the other hand, is looking at variation. So it's looking at a specific process and saying, what is the actual variation that's occurring, and trying to eliminate variation. So there very much are two different goals here. Lean is to reduce waste, and Six Sigma is to eliminate variation. So if you're thinking about a process, for example, in hospital-acquired conditions, one approach a Six Sigma project might include would be to look at the actual process that takes place from a hospital-acquired condition being identified in a patient to the actual end point where the patient's condition is quote-unquote billed to insurance or discharged, and following through the actual process of the physician notes, the coding of the physician notes, the interpretation of those notes by the frontline billing staff, the way the billing staff code that, how that's entered as far as payments, and identifying as whether something is a hospital-acquired condition or something else. So Six Sigma, again, is really trying to look at variation. So it becomes important, again, for individuals in hospitals and healthcare organizations to pause and think about what are we trying to achieve, because the methodology that you use for Lean is not the same as the methodology that you would use for a Six Sigma project. This particular chart is actually a really nice way to look across a variety of processes, and as someone becomes, if I can say, involved in or takes their first dive into Lean, Six Sigma, and quality improvement, they come across a number of different kinds of ways that they hear about to manage quality and improve quality. And this is a very simple diagram that just sort of shows the expansion and improvement of the methodology and how it covers different kinds of achievement and different kinds of goals. So the very first box in green, the 5S box, that's really when people start to look at their quality processes, and they're looking at different kinds of ways in which an organization can manage quality. So 5 S's is a particular methodology that refers to sort, straighten, shine, standardize, and sustain. And it's a process that gets put in place in an organization really to look at a process and say, how do we get from point A to point B, and are we organized, and have we got things labeled? So it's a very, very basic first step. The next step in the leadership development is looking at standardizing work within an organization and using various different tools that come from the manufacturing industry that help to map out what's referred to as a value stream. Value stream is really about understanding the components it takes to start from the beginning of a process to the end of the process. And then as you see in this particular diagram, that there is a growing awareness and a different kind of focus as you move to project management, mature lean, and then into Six Sigma. And then again, I just want to point out with the mature lean and Six Sigma, if you look on the far left-hand side, the focus of mature lean is waste reduction, and the focus of Six Sigma is value added. So they are very distinctly different components of approach to quality improvement, and very, very important for organizations to understand that. One of the things that when we work with organizations initially who are thinking of embarking on quality embarking on quality journeys, one of the things that we try to do is really create a framework for the organization that helps them to understand that terminology of Lean and Six Sigma. Those of us that have experienced expertise or extra training in Lean Six Sigma methodology often use these terms interchangeably because we've been trained in what they mean. But the really nice way to think about the quality improvement journey is what's referred to as the DMAIC model. And the DMAIC stands for the 5 items you see on the slide right now. Defining a problem is the first step. Measuring the current process that you have is the second. Analyzing what you have discovered in your measurement to identify what causes the problem you're concerned about. The fourth step is identifying solutions and mechanisms by which you can improve the problem or the performance or the process used to create the outcome. And then the last step is controlling. It's embedding the solution in the organization, so the new way of carrying out the process, the new and improved way, becomes part of the organizational culture. So it's a nice framework for thinking about quality improvement because all components of quality improvement, regardless of the tool you use, very much have to go through that DMAIC process, that 5-step process. This chart is particularly helpful as an example chart. And again, I want to emphasize that when you're new to Lean and Six Sigma, you may not be as familiar with the tools, and they can be somewhat overwhelming for a consultant or a quality expert who can come in and talk about an entirely large, if I can call them, toolbox full of tools that you can use in quality improvement. If you see, we'll just start with this particular, this visual diagram on the top right-hand side is defining the project. And in that, again, it identifies the purpose of defining a project or a problem. And then in the red, it lists different kinds of tools that you would use. So SIPOC is one tool, process flowing, charting is a second tool, fishbone, etc. Those are various tools you use to help define a problem. If you look at the next step and measure, there are a number of tools that are used to measure the processes that are being used. So as you can see beneath that, there's examples of input-output charts, process optimizers, and those are statistical tools that help you measure an actual process that's occurring. Analyze is a step in looking at the data that you have, and again, if you look at the examples there, you have a Minitab example, which is that's a statistical program. On the left, you have simulation, and these are tools that you use to complete an ability to analyze a particular data or a process or a problem. Improvement involves dashboards and different kinds of charting diagrams. So it's looking at how do we set the standards in place to improve our process and how do we measure it. And then the control at the end on the top left, again, is bringing back to different kinds of flow charts and methodology that helps capture how we are embedding the new process into our organization. I share that only simply to help people know that when you think about Lean, Six Sigma, quality improvement, there are many, many tools, and in beginning the journey, the important part is to think about what is it you're actually trying to achieve and what part of the DMAIC process do you want us to think about depending on the problem you have. So you're trying to identify the stage and move forward through it to help determine how you will develop new processes. This is a really nice, simplistic way to look at the DMAIC process and the typical questions that are asked during the different steps. So, for example, under define, you can look at questions are what is the problem, what is the scope of our problem, what are the important metrics that we need to evaluate to measure this problem, who are our relevant stakeholders that we need to involve, and so on and so forth. And so as you see in each one of those different parts of that DMAIC cycle, there are different questions and focuses we want to have. All of these are critically important to have, and they actually need to all be done somewhat in the order that you see in front of you in order to methodically go through the quality improvement process. So just wrapping up quickly then, at a 30,000-foot dive into Lean and Six Sigma, really what we're trying to take away from this webinar today is just the importance of understanding that the emphasis on financial accountability attached to patient outcomes as measured by quality and safety events is a significant change in our industry that in all likelihood will not go away. So it's become a very, very important financial imperative for institutions to think about process improvement. How do we as an institution improve the processes we use to provide care in order to optimize those outcomes? Process improvement, as I said, can be incredibly complex. I mean, there are no end to the thousands of books you can read on process improvement, but process improvement really follows that very specific methodology of using that DMAIC model of identifying and defining a problem, interpreting how you will measure your problem and analyze it, what are the steps you want to take to improve it, and how will you control it to ensure it becomes part of it. Remember that Lean and Six Sigma, and when people use that terminology, remember those are tools. So Lean refers to a set of quality improvement tools. Six Sigma are a set of quality improvement tools, and they're different. And it's not important that you memorize all the tools, but it's important to recognize they have different goals and different expectations. So understanding that helps you to ask important questions on quality improvement projects in order to determine what exactly are we trying to achieve and how do we best achieve that quality improvement. So what I recommend to all organizations as they go forward in their Lean and Six Sigma quality improvement journey is be involved with people who have experience in this area, people who've had training, so whether that are internal people inside your institution, whether you're using the expertise of external consultants, or whether you're using the expertise of university research partners. There are a number of people that can help you move along your journey in Lean Six Sigma and quality improvement and help your organization optimize its patient outcomes. Last, I want to just share these are 3 particular resources that I find when I work with client organizations are incredibly helpful for the hospitals to have. To the right and the left, the Practical Lean Six Sigma and the Lean Six Sigma Pocketbook. Those are absolutely fantastic books to give you a really good introduction to that concept of Lean and Six Sigma and exactly what are we trying to achieve. And then the middle report, I can't say enough for this resource, the Institute for Healthcare Improvement is, if you haven't been there, it is the most incredible treasure chest of wonderful resources in quality improvement, adverse event improvement, and improving healthcare delivery period. So that's a very, very good white paper, the Going Lean in Healthcare. It's a fantastic starting point. So I absolutely encourage organizations to have a look at the IHI's website. So that is our deep dive webinar for today and a quick overview of the concepts of Lean and Six Sigma and how they fit within quality improvement processes for organizations. If at any time you would like further help with understanding any of this content or would like to discuss how it's applicable to your institution, please feel free to contact me at the contact information you see on the screen. Thank you so much for your time today, and thank you to the Center for Healthcare Organizational Transformation for giving me the opportunity to speak today.
You're welcome, and thank you very much for that informative webinar. Thank you all for joining this webinar. Have a good day.